Welcome back, everybody. I'm Keith Friedenberg, Chief Operating and Innovation Officer at CHIME, and it's my pleasure to welcome you to the CHIME Innovation Virtual Summit. Hopefully, you've enjoyed both the opening keynote in our last panel session on employee well-being and safety, but we've got a great session coming up for you in just a moment or two. Before we get started with that, I just want to say this program really wouldn't be possible without the amazing support of our Innovation Summit sponsor, Profit Advisory Group. We just want to thank them for their tremendous support. There's no doubt healthcare organizations are facing significant financial headwinds and constraints. And as we've heard in the previous two sessions, these financial constraints and pressures can limit our ability to invest in really, really important workforce programs. That being said, we've got a great group, a panel of experienced leaders with us today. I know they're eager to share some of their innovative and creative approaches, what they're doing to really find ways, really creative and innovative ways to invest in their teams. So let's go ahead and introduce them. If they can start turning their cameras on. First up, I'd like to say welcome to Ken Rita. Ken is the co-founder and managing partner with Profit Advisor Group. Ken, good to see you. Also joining Ken is Scott McLean, Senior Vice President and Chief Information Officer with MedStar Health, and Chair of the CHIME Board of Trustees for, I think, 20 more days, Scott, something like that.
Yes.
So welcome, Scott. Great to have you here. And Linda Stevenson, Chief Information Officer for Fisher Titus Health, and also a member of the CHIME Board. Linda, Scott, Ken, welcome, and thank you all for joining us here today. It's great to have you.
Thanks for having me.
All right, fantastic. Great to see you all. So let's go ahead and jump right in, right? We know organizations are really feeling the pinch. So we'll start with a bit of a softball for you all, right? What innovative strategies have you implemented to manage some rising operational costs while still investing in workforce development and retention programs? Maybe we'll start with you, Scott or Linda.
Sure. Well, I don't know if I have real innovative strategies for this, but at the beginning of pandemic, we knew it was going to be an up and down ride, right? That there would be probably some federal government relief. And we talked to our the analysts for our bondholders and to our board about trying to achieve a 2.2% margin over a series of years, as opposed to our traditional goal of 2.2% per year. So as of FY24, through that roller coaster cycle, we evened that out to 2.2%. So like everyone else during that time, one of the biggest costs was traveling nurses, right? And so we had to make that investment, and that was what put us on some of that roller coaster, even if there were windfalls, so to speak, from the federal government. But then we moved to use different strategies for incenting nurses to stay on time full time, or have the ability to pick up different shifts. So over time, this didn't happen overnight, but as the pandemic waxed and waned, we had different incentives in the nursing structure to try to reduce the cost there.
Yeah.
And probably like everyone else, very strong supply chain, aggressive supply chain negotiation for products, especially pharmacy, taking advantage of the 340B program. And then as part of this, because of that fine balance, we were able to also invest in some merit increases for our associates, not every year during that time period, but in a lot of the years. And I think that helped us be able to keep people going. And we'll probably talk more about that in future questions.
Yeah. Thanks, Scott, for getting us started. Linda, let's go to you. You're in a different kind of position as a rural healthcare provider, right? So you face some really unique challenges. What are some of the things that you're doing to try and creatively invest in workforce programs?
Yeah, amongst the things Scott just mentioned, and we did a lot of the same things, from merits to 340B, et cetera. From a larger perspective across the clinical areas, one of the innovative things we did was pursue international nursing to recruit nurses, because it's a constant shortage. And to this day, it's still a shortage problem for us. So that's been a very successful program for us. Still a challenge with getting through the visa process, and that's a government dependent thing. So that's been a bit of a challenge. But I think we have to remember that not everything to keep your people retained and happy costs money, right? So it's everything from really being a great leader, doing one-on-ones with your team, re-recruiting all the time, skip meetings, rounding on your teams, whether that's clinical or IT division, we've done a really great job at putting together programs that keep people growing and learning, which I think really makes them want to stay. So we have a successful supervisor program, we have leadership programs, we have what we call our Women's Edge program for women leaders, really to recruit and promote and get them comfortable with being leaders. Because as you know, in healthcare, there's a lot of women, they come from the caregiver roles. And as they move up into leadership, that's really not something they were trained to do. So
Yeah.
these programs have really helped us to try and maintain what we have here at Fisher Titus.
Yeah, thanks, Linda. Ken, at Profit Advisory Group, I know you spend a lot of time with healthcare organizations. What are you seeing out there in industry in terms of the kinds of financial pressures and stresses, and how some of those organizations that you work with or speak with are, how are those stresses exacerbating some of those workforce issues?
Sure. And we're kind of in a unique position because we work with rural healthcare, small hospitals, all the way up to very large IDNs that might be multi-state with hundreds of acute care facilities. So we see everybody has the struggle and the feeling the financial pinch, but depending on what type of service they are, what type of hospital system they are, size, et cetera, location, really what their need is really dictated by that, and what we've tried to do is through better technology, helping their IT departments achieve better technologies by partnering with their key vendors to help maybe finance or fund some of these changes. By putting new technology in the hands of the caregiver and the patient, it improves their experience. And we found that it also helps work for retention when they have the tools they need and the technology they need to do their job.
Yeah. Thanks, Ken. Scott, you mentioned that you were sort of fortunate enough to be able to offer merit-based increases. A lot of organizations today are finding themselves in a situation where raises and increases are off the table and bonuses are off the table. Linda's nodding, so I'm guessing you all have probably faced this before in your careers. When you've been in that situation, how do you creatively work through that with your teams, right? Because you can only do that for so long.
Yeah, I mean, I think that in my experience, both here and then previously at Mass General Brigham, people work for not-for-profit healthcare for a mission, right? They care about people, and whether you're in technology or direct patient care, you're looking to serve people. And generally, these organizations, I think, perform an awesome mission across this country and the world. It's imperfect, it's highly regulated, it's costly, it's thin margin, but people are dedicated, and we saw people run through walls during the COVID period to create systems that helped handle the disease and obviously buildings and tents and building out convention centers and all that sort of thing. So what we try to do also is, first it was physician burnout, then it was clinician burnout, then everybody's burned out, right? And so we went from wellness programs for clinicians to wellness programs for everyone, which I think, a lot of online resources, some tangible physical resources as well around the hospitals and administrative sites. I think those investments we've seen in a very recent associate engagement survey, that those are really appreciated, that they felt leadership and management was really paying attention to their well-being, which I think goes a long way with people who are doing it not for the money so much as for the mission. And of course, as you say, it can't go on forever. So we've been very pleased to be able to offer the increases that we have. The other thing is, I think every area of the organization, and I'm sure this is true of others, has looked at, are we investing in the right programs? I think we have flipped sort of out of necessity from a lot of in-person education to online education. So we've been able to continue to offer things, not just critical clinical education, but also professional development education through online programs that are less costly than in person. A couple of ideas.
Yeah, thanks, Scott. Linda, maybe over to you. You mentioned something that really resonates, and particularly we've heard this in the previous two sessions already. Not everything that you do to support your workforce has to cost something, right? So what are some ideas, creative strategies you've used at Fisher Titus Health?
Well, let me speak specifically to some of the IT division, and I
Yeah.
think it's we talked to all the well, Scott said very well the work-life balance we're having, the challenges around stress. I don't think there's one department that is more stressed than our IT department. They are in constant fight or flight mode with cybersecurity and always more projects than there are people, and it's really hard on them. So to that end, we do several things. We do interns to give them some support whenever possible throughout the year, you know, especially summer with college students. That is a big program that we provide. We do Wellness Wednesdays. So to Scott's point, we meet internally to IT division to say, hey, what are your specific challenges? And whether we do a class on breathing, maybe we do a yoga, maybe we do a little bit about work-life balance. And there's a lot of different things we talked one day about sleep and how to get a good night's sleep because that was important. So none of these things are costing money. It's just time and effort and thought. And then so one of the other things we do is vendor partnerships we talked about. You know, we need to do more with less, and some of that sometimes that's by partnering with a vendor that's going to allow us to pilot things like that. Because the more we can automate, the less burden our staff as a whole has. And that's been something we really focus on. You need the ROI there because without the ROI, we can't pay for it. But that's been one way that we can reach out to the masses, still allow money for raises because we're finding an ROI in other ways to be able to pay for those ongoing merit raises.
Yeah, thank you. Dr. Zafar Chowdhury is our closing keynote speaker, and I know I miss an opportunity here if I didn't say, if we're not talking about AI, it's not a party. So I'm just curious for all three of you, are you using, I'll say, lower cost AI tools to help your teams reduce repetitive tasks and just feel like they're really focused on the higher impact, higher productivity programs? Are you all doing that?
Yes.
Yeah. Is that table stakes these days, Scott, or?
Well, I mean, we talk about, what is the definition of AI, right? So AI has been around for a long time, generative AI, a couple of years now. It's hard to say. We're definitely using robotic process automation, which I'm not sure is AI, but that's a great tool to help, keep humans on higher level tasks and have machines do repetitive tasks. Certainly, the ambient speech recognition software has an element of AI in it that I think is really helpful and popular. We're still in the process of adopting, so it's, I think we're still measuring that. And then I know organizations are looking at, not just chatbots, but generative responses that can actually handle human conversations. And of course, AI generated inbox message responses that would be curated, but then checked by a physician before they sent them out. So, I think there's a lot of potential. It's a tool like anything else. And, we go to conferences, we see people talk about it. And, what plays in my mind is the people process first and then applying the technology. And it's not going to be a magic bullet if you don't think through those things.
Yeah, and listen, these technologies are sometimes very expensive, right? So, but the promise and potential of reducing or removing repetitive tasks, reducing or eliminating clinician burden, right? Nurses, physicians, other clinicians, the promise and potential is there. So to the extent that these tools make sense within your culture, your organization, and what you're trying to accomplish there, it's like I said, it's not a party if we're not talking about AI. Ken, over to you. Linda mentioned that the power of collaboration, right? Whether that's with other vendors or other organizations to help you sort of reduce some of these financial pressures. Again, Profit Advisory Group does something unique, and I say you sort of turn over the couches to try and find the change, but it tends to be a lot more than just change, right? To help organizations creatively identify capital that can then be potentially leveraged in technology investments, workforce programs, et cetera. Tell us a little bit, if you've got an example where you've really had a success, I'd love to hear a sort of a case example.
Sure. Working with a large IDN that we're currently working with, who did not have the resources or the people resources or the money to make some changes that they wanted to do to replace or get rid of their legacy debt, if you will, that they had of old technology. And through our negotiation with their primary vendor, who is a partner, and we kind of introduced the concept of they're your partner. Let's go to our partner with our problem. Our problem is we need to do this. We just don't have any money to do it. We don't have enough people to do it. So what we were able to do in that case was to get the partner to give the healthcare system a full-time PM to run the project. And this project's now been going on for 10 months, and they're looking to extend it into 2025 when it ends. It's 11 months now. And a full-time PM to work the program, an engineer to help engineer the program, and feet on the street with technicians to actually go in and plug all the cables into all the different things, because they just did not have those people on staff, right, to do that. They didn't have the money to hire outside people or have internal people. With everybody, like Linda had mentioned, everybody's just working their tail off in IT, and there's just not enough time. So what we were able to do was make this a zero cost. Literally could have been upwards of about $750,000 worth of additional support given to this provider. And the partnership really has mushroomed into a great partnership. The IDN loves this company. This company supports the IDN. And at the end of the day, they're retiring all that, and they're putting the savings that they got from retiring that into new technologies such as AI, additional cybersecurity, et cetera.
Yeah.
And what we're doing is now using that model, and we've taken it to two other clients of ours, same type of model, and we're working it again with them because we knew it worked here. Well, if you could do it here, you can do it there too. So now we're implementing it at a couple of our other large clients. And this doesn't necessarily have to be a large client, but our other client. And it's worked out really, really well, because the carriers that are good are the ones that are going to partner with you, and they're going to realize that we all have skin in this game.
Yeah, there's no doubt about that. And again, thank you for sharing an example. I mean, this is how you get really, really creative, but also leverage the power of your vendors, your solution providers, your partners out there, right, Linda and Scott, to help you identify ways to address some of these financial pressures. Linda, when I think of financial pressures, I think of a lot of conversations you and I have had, particularly this year, because well, you face some big ones. And we talk about how you've really been creative in terms of finding the opportunity to invest in technologies. Some technologies, Fisher Titus Health, badly needed, right? And you have a lot of needs. And so you're always trying to balance, like, this is the capital we have. We may not have enough for this. Tell us how you've been creative in terms of finding opportunities to invest in not just workforce programs, but really core patient-focused technologies and capabilities at Fisher Titus.
Yeah, I think there's three different things that I focus on. First one is ROI, and that vendor needs to come to the table and have the conversation about what is the expected ROI on this.
Yeah.
I can't even entertain it if that's not there. So that's like kind of the first step. I think
Yeah.
as a small organization, we also have the ability to move more quickly than some of the larger organizations. So that is really so when we talk about vendor partnerships, that really benefits them. We can get quicker to the table, we get things out quicker, and we are great reference clients because we are able to really move at a different pace. So that gives us a little bit of an advantage. So look, okay, can you change pricing if I'm willing to be a reference client? Can you change pricing if we can just do a pilot? Then I can prove the ROI, and then we can, go farther down the road. So all of those things. On the last prong is I can partner with other organizations, and there's a group, for example, is called Vantage Group in Ohio here, where other rural healthcare organizations are coming together because we don't have an integrated network with other hospitals, to say, how can we come together and choose this vendor for all of us and bring that vendor to the table, have the conversation about, hey, we all 10 of us want to go forward with XX software. Can you give us some discounted pricing that maybe the larger organization might get that we aren't normally able to get? So a lot of different things we try. You got to get creative.
Yeah. Scott, how about you?
Yeah, I mean, I think all the things Linda said are exactly right. And I mean, there are some fundamental technologies that we need, right? We can't do any of this stuff, fundamental operations like EHR and revenue cycle, without networks. And so I think it's a for everyone, it's tempting to go after the shiny points of light, the thing that says AI on the front of it. And we've really been focusing a lot on technology infrastructure and trying to prioritize and forego the temptation to put the things on top that look nice while things underneath are crumbling. And I think that fortunately, because of the margin, there's been enough capital to reinvest in that. And I think a big part of what we've done in the last several years is slow down the things that people are really demanding at the end point and say, hey, we got to address the stuff behind the walls. That will put us in the best position to be able to take care of things long into the future and whatever comes down the pike for really interesting and I'm sure what will be successful technologies on top of our transactional systems.
Yeah, thanks, Scott. I want to talk a little bit about the pressure to reduce expenses, call it cost cutting, if you will. I'll share a quick story of a conversation with the CHIME member I had earlier this year who said that he was meeting with the CEO and the CEO said, hey, you had IT, digital health, and we need to reduce the operating budget by 25%. So go use your magic, right, with all the IT stuff and go ahead and do that. And then while you're at it, go ahead and reduce your own IT budget by 10%.
Yeah.
And the response was, well, I can do a lot of really great things, but I'm not a miracle worker. Nevertheless, right, what I hear consistently from CIOs and other CHIME leaders out there is you are all being asked to do more with less, sometimes significantly more with significantly less. So in the face of sort of that environment, how are you addressing the need to manage and reduce expense, keep quality up, right, while maintaining that sort of motivated, engaged workforce? Because that's a lot of pressure, right? That's a lot of pressure.
Yeah, I mean, it's not for the faint of heart, and it is a little bit amusing to both rely so much on technology. Everything that people want to do has a technology element, just like having lights or plumbing, and yet we do need to look for the opportunities to be more efficient. And so, one of the things that we really try to do, and it sounds like a simple thing, but being very aggressive about contract negotiation and trying to get the best value out of the products and services that we buy, and being sober about, not buying things that we're going to use 20% of, which is a really hard discipline to do, especially when people are waving bells and whistles in front of you. The other thing that we do is we always have an out clause for convenience. So that's a really tough conversation because it impacts how the suppliers book revenue and all that sort of thing. But we want to be able to control our destiny in any given financial environment. So doing some of those things allows us to be more nimble and be able to invest in the workforce and do some of the programs we talked about earlier. But and also like during the COVID period, we had very tight controls on FTEs. So even if you had a budgeted FTE, it required 3 signatures, the EVP over the function, the CFO, and the chief people officer.
Wow.
And believe me, that can take some time. And there was some flexibility there for the, to slow that down. So.
Yeah. Thanks, Scott. Appreciate that. Linda, any thoughts you'd like to share?
I agree with everything Scott said. Contracting is key. It's really important to do the best you can in that world. But I think one of the things we also did over the last year is, as we want to spend, let's call it $100,000 on whatever the shiny object is. And some of them, yes, they're shiny objects. Some of them really do have a good benefit, or at least we plan to. But how are we going to pay for that? So if you need 100,000 here, where is it coming from? So have that conversation about where's the application rationalization and the look at everything that we've had. Yes, you might be paying $100,000 for this old system, but are you really getting the benefit out of it? How much are you really using it? And having that hard conversation with each of the divisions to go through that list and say, what do we cut? Where do we take it out?
Yeah.
So that's really been important for us. And then the last thing I do is to have at the chief level a conversation. I call it the accountability tracker for everything we implement. What is the expected outcome? It's got a date. We're going to measure it. We're bringing it to the table. And if we're not getting that, well, what are you going to do, chief, who wanted this tool,
Yeah.
right?
Yeah.
So it's not about an IT decision. This is about
Yeah.
how are you going to make sure we get the benefit.
Yeah, thanks. Ken, what are you hearing out there in the organizations that you're speaking with?
In piggybacking a little bit on what Scott said, I'll just use an example of a rural healthcare client we had in South Carolina that we went through and we looked at all their spend and really started to see what are you using and how much are you using of it and so forth and so on, and just really says nice to have, should have, need to have. Do you need 3 emergency backups here? I mean, those types of things. And the interesting thing was we were hired at that case by a CFO, and we brought to him the opportunity, and it was, they saved a small hospital, but they saved roughly about $150,000 a year. And he looked at me and he goes, you just saved us 2 to 3 nurses, because that's the way he looks at it, right? It's like, do we need that? Nice to have. So we kind of got rid of all the nice to haves and just kept need to have, and it saved a couple of nurses, 2 to 3 nurses, their jobs. Those are the types of things we look for.
Yeah, I don't know a single CHIME member that I speak to who's not looking at app rationalization, right? In making sure that everything that you have and are using, you're utilizing effectively and fully. So a great conversation there. Believe it or not, we're already starting to run out of time, and I have so many more questions that I want to ask of you all. But let's just think about best practices and maybe try and share a nugget or two with those who are with us today in terms of fostering innovation and creativity in the financially constrained environment where we all hope that eventually we'll start to pull out of this, but this is the environment we're in. And we've been in this for a while, right? So if you can offer a tip or a suggestion on how you can foster innovation, foster creativity across your teams in this environment, what would you say to your colleagues and peers out there?
So,
well, I would just say, I mean, I'm not sure it's particularly creative, Keith, but it's and Linda started touching on this around application rationalization and things like that. It's about discipline. You only have, like Linda said, the money to pay for something new if you take it out of something, you know, that you're not using that well today. And so I think governance, prioritization, and visualization. So one of the problems that I've been working through, which I hope to, you know, have my team's working on some really great materials, is any given executive, but by the time we get some sort of project, there's no bad projects. Everything's great, right? And in a vacuum, any given executive is going to say, yeah, I want to do that. So, you know, being able to show them in some simple way, hey, there's currently 382 IT projects going on, and categorize them by attaching medical devices to the network, or, you know, installing a new EHR module or whatever it is, a real estate expansion. You could show them all that and say, okay, so here's what the blueprint looks like. We recommend that you not do this, this, and this because we estimate these things are more important. I think being able to have that conversation, not every day, but it might be weekly, monthly, you know, where as executives are saying, yeah, I want more of that. You say, well, you want more of that, then these things they're going to stall, right? Because they're just as limited resources. So,
yeah. And that transparency is really key. Thanks, Scott. Linda, how about you?
I agree with everything Scott said. To take a little bit different approach, one of the things that I think we could do is listen to our people. Whether it's frontline IT, frontline nursing, whatever that is. We've done several things over the last year or two to really begin to say, what do you see? What are opportunities that you see at the front line that maybe we don't think of? So we had something called a My 2 Cents program here over the past 2 years where frontline staff can submit savings opportunities, whether that's, you know, different kinds of paper towels in the bathrooms, you know, who knows what it could look like, right? But those things make a difference over time. Everything adds up, right? Within IT, we have what we call our innovation challenge. So all of our teams within IT came together with ideas that they could implement across the organization, and a winner came out in the end, and we implemented some of those ideas. And then we also within IT have what we call brainstorming day. We get in a room and we get posters and we get Post-it notes and we say, okay, here's the different strategies for the organization. What do you all see that where we can make a difference? And then I make sure to follow up on every single one of those items and say, great idea, gonna do it. here's why we're not going to do something else. But I think getting that frontline input in any creative way you can, and then they feel important as well.
Yeah, and engaged. That's some really great tips there. Ken, we're gonna wrap up with you. Any thoughts you would share with the audience?
Yeah, the areas that we look at are that bottom line, the infrastructure piece, the stuff, the nuts and bolts, the networking, et cetera. How do we reduce those costs to allow us to buy the nice to haves or the advancements? And that's really what we work on with almost all of our clients. We're at the bottom level of the hierarchy of telecom of IT needs, and we help them fund the applications, the AI, the other things down the road. And that's really, I think, a critical thing that most of our clients are looking for.
Yeah, fantastic. Be practical, right? Focus on ROI, be creative where you can and when you can. Look for opportunities that are low cost to engage your workforce and drive retention, and find a great partner. If you can't find one out there, reach out to Chime. We can certainly help you. With that, we've run out of time. So I just want to take a moment again to thank all of our panelists, Linda, Scott, Ken. Thank you all for joining us today and helping us continue the conversation around, developing, thriving, and resilient workforces, in particular in the face of real financial pressures and constraints. We're going to take a short break now. Don't go too far. We'll be right back here in 10 minutes. We have an amazing closing keynote speaker ahead. Dr. Zafar Chowdhury will be here with us. He's going to explore strategies to foster a culture of adaptability and innovation within your healthcare teams. We're going to look at the importance of continuous learning, how to embrace new technologies, even in the face of financial pressures, and encourage creative problem solving to promote adaptable and innovative cultures. Right back here at 3:05 p.m. Eastern. We'll see you then. Thanks again.
Thank you.